Once again, congratulations to all the award recipients. We are deeply grateful for their contributions and leadership. I'm very proud that the class of 2024 is the largest ever for addiction medicine, with 212 fellows graduating this year. There are now 104 ACGME accredited addiction medicine fellowship programs. These graduating addiction medicine specialists were trained at 82 of these programs from 36 US states, Puerto Rico, and the District of Columbia. We're also celebrating 5 fellows from British Columbia, the Center on Substance Use. You'll have a chance to learn a little bit about the class of 2024 fellows shortly during our virtual procession with the graduates' photos, educational background, and post-graduation plans. Before our graduates cross the virtual stage, we would like to share recorded remarks from Dr. George Koob, Director of the National Institute on Alcohol Abuse and Alcoholism, and Dr. Nora Volkow, Director of the National Institute on Drug Abuse. Unfortunately, both were unable to join us live this year due to prior engagements. Dr. Koob is a leader in research involving the neurobiology of addiction. He earned a PhD in behavioral physiology from Johns Hopkins in 1972 and did postdoctoral work at the University of Cambridge and Walter Reed Army Research Institute. Prior to joining the NIH in 2014, he served nearly 20 years at the Scripps Research Institute, where he directed the Alcohol Research Center and chaired the Committee on Neurobiology of Addictive Disorders. Dr. Koob is recognized internationally and has authored more than 650 peer-reviewed publications. During the 20 years that she has directed the National Institute on Drug Abuse, Dr. Volkow has been instrumental in advancing the understanding of addiction as a brain disease. She earned her MD at the National University of Mexico, did her psychiatry residency at New York University, and served as professor and associate dean of the Stony Brook University Medical School, among other positions. An accomplished research psychiatrist, Dr. Volkow, like Dr. Koob, is a leader in the neurobiology of addiction. And like Dr. Koob, she has been a longtime friend and enthusiastic supporter of addiction medicine.
So, congratulations to the class of 2024 of the American College of Academic Addiction Medicine. I'm George Koob. I'm the director of the National Institute on Alcohol Abuse and Alcoholism at the National Institutes of Health. I just want to talk a little bit about alcohol and changing the conversation about alcohol with you. This cartoon says I'm right here in the room and no one even acknowledges me. This is, and my name is alcohol. I think you get the picture. But I often emphasize this point with a quote from John Kelly and Sarah Walkman from the Recovery Institute at Harvard Medical School. Most middle and high income countries globally have become largely inured to the endemic premature mortalities related to more commonly used substances such as alcohol and tobacco. While these account for a much larger number of deaths and economic and social harms than opioids each year, the devastation wreaked by these substances, their casualties, and the associated blood and tears are all relatively willingly absorbed into the social fabric. To this end, we have about 30 million people in the United States with an alcohol use disorder. We lose about 180,000 people each year to alcohol-associated deaths. And deaths have been increasing. The average estimated annual deaths from excessive alcohol use increased 29% from 2016 and 2017 to 2020 and 2021. Even alcohol-related fatalities went up in 2021, the highest number since 2006. And alcohol was listed as in 1 out of 6 drug overdose deaths in 2020 and 2021. But even perhaps more important is it as to why alcohol research is critical. Alcohol misuse is associated with more than 200 diseases and injury-related conditions. As you can see from this slide, it ranges from mental health to liver disease to cancer. Alcohol misuse can cause damage to nearly every major organ system in the body. The liver is the primary site of alcohol metabolism, making it particularly vulnerable to alcohol-related tissue injury. Alcohol is also the leading cause of acute and chronic pancreatitis, and about 1 to 5% of US children in the first grade are affected by fetal alcohol spectrum disorder. And the National Cancer Institute now estimates that 5 to 6% of cancer is caused by alcohol. So we're trying to change the conversation around alcohol with our work at the Institute. We're emphasizing the following points: raising awareness about the scope of the problem, embracing the changing culture around alcohol in society, tracking drinking trends and consequences, advancing alcohol screening, brief intervention, referral to treatment as part of routine healthcare, promoting widespread use of the healthcare professionals' core resource on alcohol, assessing and implementing the addictions neuroclinical assessment framework, which we consider a window on individualized etiology, prevention, and treatment, enhancing recovery research, supporting research to integrate alcohol use disorder treatment with treatment for co-occurring conditions, with hepatologists leading the way, and combating stigma and disseminating NIAAA resources. Just to make a big point about the healthcare professional core resource on alcohol, it's what every healthcare professional should know about alcohol. It's organized into 14 concise, practical, user-friendly articles for healthcare providers who are not addiction specialists. It can help overcome barriers to care for patients with alcohol problems, including ways to counteract stigma in their practice. Includes information about clinical impacts of alcohol, including cancer, pain, medication interactions, and co-occurrence with other substance use disorders and mental health disorders. Free continuing education credit up to almost 11 credit hours is available. I'd like to end my little remarks here by mentioning some career development points from me. Celebrate your successes and learn from your challenges. Choose a mentor with a healthy medical academic lineage. Find a guardian angel or 2 or 3 to help you along your career. Be generous with collaborators, connect with your peers. And in this day and age, network, network, and network. And to quote the Bard, this was written by Bob Dylan and recorded by Bob Dylan in November 1973 in California. May God bless and keep you always. May your wishes all come true. May you always do for others and let others do for you. May you build a ladder to the stars and climb on every rung. May you stay forever young. May you stay forever young. Thank you very much, and enjoy your graduation.
Hello, everyone. I'm Dr. Nora Volkow. I direct the National Institute on Drug Abuse, and I want to thank Dr. Alex Wally, ACAAM president, and all of the fellowship program directors for the opportunity to speak at the 5th Annual Addiction Medicine Fellow graduation event. It is an honor to be here with you, even in these virtual settings, to applaud the 2024 graduating class of Addiction Medicine Fellows and the recipients of the 2024 Keeper of the Flame and Kevin V. Combs Awards. Your dedication and hard work has paid off, and it's inspiring to celebrate your academic achievement. As you gear up for your career in addiction medicine, it is important to recognize the significant role you'll play in society and the positive impact you'll have on countless lives. Addiction is a complex disorder that affects millions worldwide, and it wreaks havoc in the individual and in their families. As addiction specialists, you've gained the expertise and skills to offer compassionate, personalized care and support to those in need. You will be in the best position to help individuals suffering from addiction to regain control of their lives and achieve recovery. Your job will not be easy. You will encounter patients who are resistant to treatment, who relapse, who struggle with curing physical or mental health conditions, and who face multiple social and economic barriers to their recovery. But these are challenges that make your training and commitment to the mission so very important. Remember, that your responsibilities and potential impact go beyond the individual patients. Addiction remains heavily stigmatized, and this is an area you can help change. You will have the power to reshape the conversation around addiction, educating both your peers and the broader community about its nature and effective treatments. Armed with evidence and persuasive arguments, you can dismantle stigma and dispel myths. The journey you are embarking on today is incredibly important. Congratulations on this remarkable achievement, and I wish you all the best.